Good morning and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm doing okay. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, our lone US COVID statistic through today, March 13th. We invite you to submit any questions or suggested topics down below in the comments or at any of our social media linked in the description. Starting today with that COVID statistic. Average COVID deaths per day in the last reported week were 66 daily in the United States. In 2024, the same week, we saw 189 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the state of COVID in the country?
Well, the number of COVID cases is actually going down, the new cases. And this is as projected. In March and April, the cases go down. January, February, the end of December are the peak respiratory months. The death rate is the last number, the last metric to change because the death occurs way after the infection starts. Person gets sicker, ends up in the hospital, ends up in the ICU. Unfortunately, some don't make it. So that number is not expected to change for another month or two. But the wastewater surveillance that they have, or they still have, is low. So that's gone from very high in November, December, down to high, medium, and now it's low. So it's happening like it's supposed to happen. That doesn't mean that COVID goes away, but it gets down to kind of a dull roar. If you remember, before the season, we were down even the 20, 30 deaths per day. But it doesn't go to zero, but it's much better than last year. So it's going to be interesting, really, to see what happens next year as the immunity keeps to build up. Are we going to be at this dull roar, or is this going to continue to decrease? It remains to be seen.
Mhm. And before we move on from the respiratory season, there was some great data coming out about the monoclonal antibody shot for infants that protects them against RSV, as they are one of the most vulnerable groups, excuse me. Can you please fill us in on that data?
Yeah, so we've talked about this before, and the data that has been presented recently just confirms what we already knew, but in bigger numbers and in different groups of patients, different geographic groups. This is a report from a study from Yale in the JAMA Open Network Journal of over 600 children. These are infants, so these are very young, under a year, under 2 years if they have underlying diseases. And the drug we're talking about is nirsevimab, or Beyfortus is the trade name. So what they showed in this was just remarkable response. 80.5% decrease in hospitalization rate and 85% overall decrease in severe disease. I mean, this is just incredible. Um, for a kid to end up in the hospital, they're usually very sick. And many pediatric units around the country have closed. Of course, in the big cities, we have children's hospitals, but through the countryside, they're just mixed in with other patients. And RSV was one of the big reasons why very young children got admitted. And so this is really just a remarkable um, result with this drug, which is very well tolerated. It's a monoclonal antibody. Another way that you can treat it if you can't get the antibody is to vaccinate the pregnant woman in her third trimester. She will make the antibodies and give the antibodies to the baby, and the baby will be protected too. So there's a couple ways to beat this thing, and this is one of them, and it's just really been highly successful in keeping kids healthy.
Which is absolutely great news to have both of those really amazing options. But looking at something that is causing us a lot of trouble. There has been more measles cases in the US since last week and an additional measles death. Can you tell us about the cases and about the unfortunate passing?
Yeah, this is really tragic because measles is a completely preventable disease. With a vaccine that's been around for over 60 years, by the year 2000, we had no cases of measles in the entire United States. Now, why do we worry about measles? A lot of people think it's just a rash, people get sick. Well, a lot of people, especially kids under 5, end up in the hospital. They're that sick. And some of them, about 1 to 3 per thousand, end up with encephalitis and can die. So this is it's a horrible disease that killed and maimed many children in the past. So what happened is there's a Mennonite group in Texas that doesn't believe in vaccines. That's their privilege, but the epidemic, the little mini epidemic, started there, and this has spread to all the people who are at risk. In other words, all other unvaccinated people, whoever they may be. And so far, they've reported 223 cases. So this is more than we've been reporting in the United States in a long time. There have been 2 deaths in one school-aged child who was unvaccinated and one adult who was unvaccinated, and also did not seek treatment until they were very, very sick and they passed away. Um, Almost all these people were unvaccinated. 5 had at least 1 dose of the vaccine. So 1 dose of the vaccine is good, but it's not great. So the recommendation is 2 doses. We don't know if those 5 people had the 2 doses or not. And the vaccines are not perfect, but they are very good. And you would not have these little mini epidemics popping up. There was also a case, an exposure to somebody who had been to Texas, who was from Oklahoma, which is the border is not that far, and that was imported to Oklahoma from Texas. So it's spread. It's a highly, highly contagious disease, and it can cause very serious consequences, including death. So you want to, if you want to stay protected, you have to you have to take the vaccine. All this stuff about nutrition and vitamin A is, uh, this is nothing compared to preventing getting measles infection.
And like you said, this has been a very well tolerated vaccine for roughly 60 years at this point. So a lot of people have gotten these vaccines and they are A-okay, and it is
Uh-huh.
great at preventing measles.
I mean, it's been around for a long time.
Mhm. Now, there's been a lot of changes in federal funding for science and global health, all of the above. Looking at two specific global issues, that being HIV and tuberculosis, can you give us an idea of what some of the effects of the funding cuts have been even so far?
Well, HIV and TB are infectious disease killers. Tuberculosis is the #1 cause of an infectious related death, with 1.2 million people dying per year. HIV has been very well controlled, starting with the PEPFAR program that George W. Bush put in place with the US government way back in the early 2000s. And that has had a remarkable impact in Africa and areas where there's HIV, not just Africa, but globally. And the number of people on treatment has skyrocketed, and the number of people dying from HIV has decreased, and the number of children infected has dropped significantly. So U.S. aid was the one distributing these drugs and monitoring things. And as you know, U.S. aid is in the process of being dismantled. There's fights in the court. But for a country like Kenya, which has a lot of HIV and tuberculosis, this $80 million gap is really starting to have an effect already, in two different ways. One is the number of drugs. You have to buy these drugs. Now, in the United States, you spend over $2,000 for a treatment course. Over there, it's like about $16 to $18. So, I mean, it's much, much less getting these generic drugs. But not only do you have to have the drugs, but these are pills that have to be taken every day. So patients have to be monitored, and you have to deliver the drugs to the clinics and have people be able to just to give the drugs away. There's a whole process there. It's more than just the drugs themselves. So the distribution and administration of the drugs, the implementation of the whole project is as critical as having the drugs. So all that is basically just completely disrupted. The WHO predicts that the number of deaths and new children infected because the mothers aren't taking the pills anymore is going to increase sixfold because of this gap that the other donors haven't been able to fill that gap. It happened so quickly. I mean, if there had been, some kind of plan to, wind it down over a year or two or something like that, it maybe something could have been worked out. But to just abruptly cut it like that, it's actually literally killing people. And the same thing is with tuberculosis. TB is a treatable disease that if you have the right drugs and again the monitoring and testing to make sure that the treatment has been successful, you save many lives. 1.2 million people die of TB per year. The United States, through USAID, was accounting for about 25% of the anti-TB effort. So why do we care about tuberculosis? Well, tuberculosis is another contagious disease. There's 9,000 cases in the United States alone. There happens to be an outbreak of 68 cases in Kansas right now. There is no real vaccine to prevent it. You can take, if you're exposed, there is a treatment that can prevent it from becoming active. But these are global diseases, really. And to pull out of this in another disease that's, relatively easy to treat, as long as you have the right resources and you have the drugs. I mean, it's just really it's just so unfortunate and cruel.
Yeah, it is so tragic. There are literally tens of millions of dollars of life-saving drugs that are in place, ready to be distributed. And like you noted, those distribution channels have just absolutely crumbled. So it's really, really sad and unfortunate. And, hoping someone can step up or we can reconsider the changes that we're making there.
I mean, you can pull out, but I mean, there's a way to do it and a way not to do it. This is the way not to do it. This is a very dangerous way to stop a program like this.
Absolutely. Now, our final story for today, also not too happy. Unfortunately, in Uganda, there has been another pop-up of Ebola viruses. This one specifically is the Sudan viral disease. Can you tell us a little bit about the outbreak itself and then where these different names are coming from?
So Ebola, everyone knows about Ebola. There was a big outbreak a few years back, mostly in West Africa, but it's spread out on the African continent. There have been little outbreaks in Congo, Uganda, and the reason why it's so bad is that although it's not spread by aerosol, really, it's really more of a contact type transmission. That's why the numbers are not so big, but the mortality rate is really high. It's at least 30%. And there are these 5 new cases in Uganda. 3 were documented. 2 are suspected. Both of those patients died. And so it's one of those things where good public health measures and there's no real specific treatment, but to keep people isolated and supported is the best thing that can happen right now with that. So it's just another one of those things out there, and it is being controlled fairly well.
Absolutely. It's good to know that those things are, being taken care of. There are public health officials on top of it. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise this morning, breaking down all the news for us and all the data. It's much appreciated.
Well, thank you, Katie, for all the good work you do.
Thank you. And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. If you have any follow-up questions, suggested topics you'd like to see Dr. Murphy discuss, Please let us know in the comments down below or any of our social media linked in the description. Have a great weekend.